Well, hi, good evening. Thank you for joining us tonight. Um, Today, I am very honored to be doing this presentation along with Nalima, and we are going to talk about our team effort when it comes to low vision rehabilitation. And that is exactly the case. It is rehabilitation because it's not just a one-time exam. We are going to work as a team to help everyone function and do their best. And so let's get into it. All right. So go ahead and advance the slide for me. Ah. So just a little bit about myself. I'm Karen Lin. I am a low vision specialist. I am in Irvine Tuesdays and Thursdays, and I have no financial disclosures. I work with Nalima, and she's going to be talking a little later, but she is our low vision occupational therapist, and we work together as a team. So, top things to remember about low vision is that it's not just about your visual acuity. So, it's about visual problems that can interfere with your daily function. So, yes, maybe it's macular degeneration. Maybe that visual acuity isn't that bad yet. Maybe it's only 20/30, 20/40, 20/50, but we might be dealing with a little central blind spot, or we might be dealing with glaucoma causing some visual field loss, or sometimes our vision fluctuates, and that can be dependent on the lighting and the contrast. So, low vision is really about the problems that might be interfering with just everyday life. And so it becomes a process that we want to work with. And it is definitely worth it. It doesn't just end with the first evaluation, it doesn't end with just the exam. Um, I will take the measurements at the first exam and I will help understand all the difficulties, the different aspects of the vision. And I might give you a preview of maybe some things that might be helpful, but then I will refer you on to our occupational therapist, Nalima, and she will do her evaluation and she will work with you on specific goals. And then she will build on top of my recommendations. And sometimes it becomes something where, it becomes completely different depending on what you need. So, like I mentioned, the main thing to remember is that this is a team effort and we are here to help you. And so it can become a process and it's definitely worth it. So, there's going to be multiple visits. But that first one is where I will take my initial measurements and give you my recommendations. So it becomes a very customized plan. So a lot of times, when we think about an exam, it might be okay, we go through specific processes and we do certain things. But in low vision, it's very, very individualized. It's, really one size does not fit all. And depending on what your goals are and what your needs are, then we focus on that. So a lot of times we think about low vision and we think, well, maybe glasses, something different, maybe something stronger might help me. A lot of times that pathology is really limiting our vision. And so, yes, maybe a different prescription may help, but a lot of times it could be something different altogether. It could be different strategies. It could be lighting. It could be contrast. It could be training. And there could also be other devices, other magnification. So a lot of times we just have to work through it and find what's best. And we'll go to the next slide here. I'm going to play a little video that kind of summarizes low vision. It's a very nice video to start with here. Well, I really like that video because it just summarizes what, there's so many different things when it comes to low vision. It's not just about devices. Um, it could be the lighting, it could be the way we organize things or strategies. But yes, definitely a process and definitely something that we can walk you through. So this is a video that's on the website. So if you want to see it, you can. And again, the emphasis is on the function, on what you do on a daily basis. And it's not really on just tools and devices. It's nice to have those tools, but how are you going to use it? And what is your goal? What are you going to be doing with it? And one of the things that we look at is what may be difficult for you. What is stopping you from feeling the independence? And so let's talk a little bit about that in the next slide. Uh, Going to the next slide here, when it advances, um, we talk a little bit about your things that can be difficult. So it could be reading. So a lot of times, it could be just reading the news. It could be detailed mailings, bank statements and such. These things you want to be able to read by yourself. So that can be very difficult, especially if there's a blind spot in the way or things are just too small. So, and then there's distance tasks like watching TV or seeing things far away. That little video did a good job talking about maybe using some telescopes that might help you see some details from far away. Mobility, just getting around generally, if there's any visual field issues, and then also with contrast and changes in weather and lighting, we can have difficulty seeing the curbs and the steps. And so I have an example here on the bottom where that gray on gray for curbs and steps just so difficult. In really bright lighting, everything can get bleached out. But then in the dim lighting, it's also tough to see. So there's a lot of different things that we want to be aware of. And then I have the other picture of the tree in the way, because you might be looking down to, just be very aware of where you're going, but might not be able to see a tree in the way if there's a visual field issue too. And then there's the contrast, right? Under a tree, it's dimmer, so it's harder to see. So all these different things that can be difficult on a day-to-day basis. There's also very individualized personal goals and hobbies. I've listed some there. And so that's why low vision becomes a very customized plan. And so in our next slide, we're going to talk a little bit about, just what would help us, a little bit more with goals and independence. So could it be something specifically for work versus something that we do for fun? Is it difficulty recognizing faces, or is it watching TV or reading on our computer? Is it something that has to do with visual acuity changes or visual field changes? Are things changing? So then now it's difficult. The way that things are set up for you now has changed. Could be glare. Glare, it can be very big, depending on where you are, the lighting changes and such. School needs, there's going to be different things. People going back to school, you got to see the board far away, but then you got to be able to read details up close too. And of course, expectations. So, what are your expectations of what you can do on a daily basis? Let's go to the next slide. So again, low vision is not just about devices. And again, the focus here is really on the function and what we do with the tools that we have and the strategies that we have. So yes, there's a lot of devices and I will go over some of them, but really it's about how you use them. And so there's the training, and do we need that for the specific goals that you may have? And again, it's not a one size fits all. There are no magic glasses. I wish there were, but really it is just depending on what you want to do with your vision and what we can do to help you best achieve that. So what happens after my exam is that I will refer you over to our low vision occupational therapist, Nalima, and then she will have that first session where she talks about specific goals. And then there's going to be further exploration of some of these magnifiers and devices, training, and also strategies or light and contrast evaluation. It just depends on what she finds to be most pertinent for you. And so, my part of the exam is just figuring out what is difficult, and get all the measurements here. So, moving to the next slide. I might start you off, first of all, with a visual acuity for far away on a distance chart, and then I might test your reading. If you look at this chart, you can see that I have the first line. They're going to go from the biggest one to the smallest, but you can see how there's a very, very kind of low contrast, kind of a gray line underneath all of these. That's something we do test as well, but I'm watching to see how you are reading. Maybe there are missed words, maybe there are words that are skipped because there could be a little blind spot. And then I also take a look to see how you are holding the chart, because if there are little tremors, it might make things difficult if we're using magnifiers. And so, these are all things I'm looking at as well. Then moving on to the next slide. So for reading, there could be magnifiers. The one picture on the top, those are we have dome type of magnifiers, we have circular ones, we have rectangular ones. The lighted ones are really nice, especially as it helps to kind of enhance everything, the contrast as well. A lot of times when it comes to certain diseases like macular degeneration, we have what we call central scotoma, which is that blind spot right in the middle. And this is where eccentric viewing or using that side vision a little bit might come into play. So this is something that the occupational therapist, Nalima, can help you with, and she does specific training for that. So it's not just about using the devices or using that magnification. It's about everything else too. And let's go to the next slide. So different magnifiers, we have all different types. Those are some of the handheld ones. You might note that some of the magnifiers, the stronger ones, are the smaller lenses. So I wish that they could make it bigger, but that's just the optics of the lenses. So we have all different sizes, and as we get to the stronger ones, it's a little smaller. Unfortunately, we have to find that balance between magnification because now things are so magnified that maybe our field of view is way smaller now. So we have to find that sweet spot of what we really need that magnification for. Maybe we're not reading small detail all the time, so we just need a certain amount of magnification, and that way we can still retain that good amount of field of view that we need. Or maybe it's just a spot read, a small detail here and there, and so maybe we do need to go stronger. So again, this depends on all our goals. And just remember that there are lots of different apps out there too. If you use an iPhone or if you use an Android phone, all the smartphones, there are different types of apps that we can train you to use. And so that could be helpful as well, along with phone modifications. Also, the video was alluding to, making things bigger on your computer as well. So these are things that we can help you with, also modifying, the contrast and other things along with it. And let's go to the next slide. So when it comes to lighting and illumination, um, there's really, I mean, it's so important to have really good lighting. Now, the picture on the left, that is a floor lamp. And a lot of this, there's different intensities, there's different color temperatures, and there's going to be one that's going to work the best. And so we generally like the ones that are gooseneck because you can bring it and focus it on exactly what you want to read, and then there's also the table lamp too for convenience. But it's always good to have a light evaluation with our occupational therapist so we can see exactly what is best for you. There's also a filter evaluation. So you can see on the top right, there's a lot of different um, filters, like sunglasses, but there's even some for indoors. And these wrap all the way around so you're not getting glare from the sides, and there's a little bit of protection on top too. And so this really works well, and there would be one, hopefully, that would be best for you. And that's something that we can try, even in exam room, but best, in a home environment so you can see about the lighting around you and what will work best for the specific task that you're doing. And so for our next slide, okay, so I mentioned this earlier. We were talking about central scotomas or those little blind spots in our vision. Sometimes they don't appear as a big black spot that I have drawn here. This is part of my visual field test that I do. This focuses very specifically on that central vision. And when we map out where it's most difficult for you, then we have a better understanding of how we can better train you for that eccentric viewing that I was telling you about earlier. So it could be in this particular picture that I have, the spot is a little bit to the left of fixation. So basically, we might train you to look a little bit over to the left to be able to use the parts of your vision that's not as affected by it so that you can see a little bit better and just catch a glimpse of what's needed. And this could help in facial recognition or watching TV or reading sometimes. So this is something we can definitely work with you on. Next slide. Okay, lot of different video magnifiers and some are wearables too. Now, you can see the top two left pictures. Those are what we refer to as tabletop CCTVs. Now, you can put the book, magazine, mail underneath it, and it will be shown on that screen. You can blow it up, you can magnify it, and you can see how you can change the contrast. So you can have enhanced contrast. That's the one on the left, where it's very, black and white. And then you can do the reverse contrast. So the picture on the right, where you have the white on the black background. Sometimes some of the patients find it easier that way because there's less glare, but it just depends on the person. Now, on the bottom picture, you see a picture of me wearing one of the wearables. That one happens to be one of the ones from iDaptic. Now, there's different magnifiers that you can wear. This one, um, there's different ones. There's different models. The newest one being i5, and then i6 is the virtual assistant component that comes with it. But these, you can put it on and the screen is right in front of you. And then you can change the magnification for far away. And so if you're looking at something, you can zoom in on it or zoom out on it. And then if you're going to read something or be on your computer or then play, maybe a game or something, it will autofocus for you. So these are great because, you can change things and it's also part of a video magnifier class of magnification. So you can have the enhanced contrast, and it's a little bigger when it comes to the field of view. And now back a while ago, they made these so that it's bigger and it covers most of your face. But you can see in these, they look like fancy sunglasses at this point. So it's really nice that way. There's also Envision glasses as well. That's on the mannequin there. Um, that is a different one where, they can help you get around. So you would have to pay a little bit of a subscription, but they could link with your phone, and there's different things that can be done on it, so it can help you get around. There could be someone on the other end. It can hook up with other programs as well. There's also smart glasses around too. I know it's highly advertised, the Meta glasses that can hook up to the smartphones as well. So it can do some of the things that we already do with Siri, but it can help us take pictures, it can take videos, and and you can even make a phone call just by telling it. So these are all things that might make life a little bit easier. Um, so in terms of wearables, different options, and there might be one that's going to work the best for you. Also, um, a lot of these things, especially when we talk about the CCTVs, and then I want to bring your attention to the picture on the top right. um, that's a smaller version of the video magnifier. So the CCTVs, those are tabletop, so you got to put it there and you bring your reading material over to it. But the ones on the top right, those are more portable. So yes, they are smaller, but you put it directly on top of your reading material. And so you kind of move it along to where you're reading it. Again, you can enhance the contrast and change the magnification. And so it would make things a lot easier when it comes to the details if you're looking at mail or, even reading a book or magazine. So these are more for prolonged reading. Some people like to look at photos and do their crafts underneath them, the bigger CCTVs, that is. There's different features for all of these, and that's why it's definitely worthwhile to work with occupational therapists to see which might work the best for you. Um, there's ones that will take the information and then they'll read it to you, and so you can follow along with it. There's ones where there's a camera attached to it, so then now if the person's in class or wanting to look far away, then they can see things with that camera and it'll show up on the screen as well. And then there's some where you can turn the camera back to yourself, and then that might allow for better grooming or, doing makeup and such. So yeah, just a lot of different options, and there's more. There's just so much that I just don't have time to cover, and that's why just trying to find out what would work best and what your goals are, then we can kind of hone in on what's going to work the best here. Go to the next slide. So for the distance test, the video alluded to some telescopes. So here's a lot of different ones here, and these are all more optical. Optical meaning, with the lenses. The slide earlier, we had more electronic type of magnifiers. So this one, if you notice, the top two, those are more telescopes. Yes, they look a little bulky and they do stick out, but they do really magnify. And so we just have to be aware that as we magnify that field of view, what we're looking at now gets smaller. So we just have to be aware of that. But for spotting things far away and for looking at things for detail, that would be helpful. The monoculars, that's good for distance spotting as well. So if it's more convenient just to hold it up and then just put it away too. We also use it as a reverse telescope sometimes, and that is more for field of view where, we might be able to get more um, field just by turning it around. So uh, there's different ways of using that. Now, in the picture on the left, that's me wearing the Max TV. Some people find just a little bit of magnification helpful for that TV watching, just to gain a little bit of details. So that's something that might be helpful. The ones on the right bottom pictures, that's me wearing side scope. That's another type of telescope, but that one kind of flips up out of the way, and then you could put it down as needed. But um, it really helps to have that magnification because sometimes glasses just don't make a difference, but then we need to go a little bit stronger, a little bit more magnification to really get some good control of the details. However, again, all of this, because we're magnifying, we just have to realize that that field of view will be smaller. And all of this takes some adjusting to and training, getting used to it. So again, when it comes to mobility, there's so many different things that we can talk to you about too. Um, there's orientation and mobility, the cane training, that's through Braille, and there's leader dogs, and there's other agencies too that we can refer you to, but they have specialized training. There's a pattern that we use to detect things, curbs and steps, because we can't afford to fall for sure. Now, guide dogs, that's also another option, but to qualify for that, you would have to go through orientation mobility training first. Now, there's also scanning training and human guide instruction, and that's something our occupational therapist can work with you on, and that's really important as well. So, if there's a visual field issue, and that's something that we can identify, it's really important to work with Nalima, our occupational therapist, on that, and she can help, you know, train the family members so that they can better help guide the patient when they're out and about. Now, I left the Sunu band, that one on the bottom, because in my previous lecture that was still around, but I've noted that they have been discontinued. Um, there are other ones like WeWalk now that people can use. All of these, either the Sunu band or the WeWalk, they use kind of ultrasonic type of vibration to kind of detect things from the wrist and up. So while you're using the cane, and that's good for detecting things down below, it could be good to have something for things a little bit higher up too. And they're always coming up with new technology be used in conjunction with the cane so that getting around can be easier. So some people like to use the cane in conjunction with all the different apps that are available, or the Envision glasses, or these new like WeWalk and guide dogs. So there's a lot of different options when it comes to mobility, and that's something that we will work with you on. Okay, and moving on to the next slide. So I put this in here more as a side note because driving is very, very case by case. Um, this is something that we would evaluate during the exam, and definitely we look at all different parts. Now, DMV does care about that visual acuity, but then, even if you don't pass, they give you a form to fill out, that DL62, and that part's easy enough. Some people do use a bioptic telescope to be able to see better, to see the street signs, for instance. However, if you think about it, and this is one that I was showing you earlier, if you have the telescope on, you lose that field of view. And so to be able to drive, we need that field of view. So the telescope, you might be using it really only 1 to 3% of the time. And so it becomes a very individualized approach when it comes to driving because there's so many different aspects that are involved. There's, besides the vision part, I mean, there's the visual field component. If bioptic telescopes were to be used, there's definitely additional training and driver's training with those telescopes. So many different things involved, not to mention, reaction time and cognition and ability. So that's something that's kind of out of my realm too. But when it comes to the vision part, even just by itself, there's so much involved. So I just mentioned this as a side note, but we can definitely address that in an exam as well. Okay, so moving on to the next slide. So in my exam, the real focus is how functional is the vision. Yes, I will check your vision. I will check your distance vision. I will check your near vision. I will use some lenses and see if there's anything that we can do to improve your vision. We'll take a look to see if there's any blind spots. Centrally, we'll see how you're reading, if there's any contrast loss, if there's any glare. And then I might give you a preview of maybe different devices that might be helpful. However, um, that different devices, I might show you a lot and everything will look good, right? In an exam room, things are magnified, things are nice and bright, and now you can read maybe quite a bit more. But is it really something that's your goal? And that's where that next step comes in, working with the occupational therapist, because maybe it's not your goal to be able to read all the way down to the very bottom. We may not need all that magnification. Looks great in an exam room, but what if it's something like the video magnifiers? What features are going to be best? And will you end up using it? And so this is why it's good to see it, to see the possibilities, and then we hone in on what is going to be most appropriate for you. So yes, my exams can be a little bit lengthy because we want to cover all the different aspects. We want to cover all the different testing and find out what's the most difficult portion. And then we'll find maybe some solutions. And then we'll refer you over to our occupational therapist to really hone in on the details. So for our next slide, just a little summary. Again, it's not based on the visual acuity, but on function. So what are we doing on day to day that is difficult? What can we do to make things easier now? And so for my exams, I really request that, your eye exam information, hopefully within the year be forwarded to me so that, I have information to work on and then see if there's been any changes to the visual acuity. Because if there is, maybe we need to have you go back and see the referring doctor just to make sure nothing has changed. And then from that point on, I do my exam and, I might take a look at your previous magnifiers and devices, any glasses, and see if there's anything that we can improve. And then I will send a letter with my findings to the referring doctor. And then I might refer you on to our occupational therapist, and that's where you would work on your goals and, training and strategies, and maybe work on what magnifiers and devices would be best for you. And we also refer to agencies and organizations that might be helpful too. And so um, one thing I do want to mention is that these days there's so many devices, and a lot of times I see people come in with just bags of magnifiers or glasses that unfortunately don't work. And a lot of it is because we get a lot of things on Amazon. And unfortunately, I wish it was just that easy. And because a lot of times Amazon will, advertise things, but it may not be that particular magnification that you need. And so we might need to go a lot stronger. We might need to realize that there's certain parts of the vision that's impacted by, maybe blind spots or visual field defects, and that's why the magnifiers aren't working. So there's quite a few components to the vision, and that's why the exam is so critical here. We have to kind of pinpoint what is definitely difficult for you, and then from that point, find the solutions that's going to work best. And so we're going to move on to the next slide. And this is where working with our occupational therapist, Nalima, comes in. And she is a critical part of our low vision rehabilitation team. She is the absolute best. And so I'm proud to introduce you to her next, and she will be speaking.
Hey everyone, thank you for joining us today. My name is Nalima. Thank you, Dr. Lin, for such a nice introduction. I am an occupational therapist and I have specialty certifications in low vision. And I'm really excited to share a little bit about what I do at Gavin Herbert Eye Institute and how I might be able to help you with my services. So a lot of times people will ask us, like, why do I need to see an occupational therapist? And what is it? And what should I expect? Occupational therapy, most people have heard about because, they may have heard about somebody who had a stroke and had OT, or had OT for any other health reasons, like medical issues. Or sometimes people may not have heard about it because physical therapy is a much easier or a little bit more well-known. So by occupation, what we mean is your ability to do activities that are most meaningful for you, and how us as therapists can look at you as a whole person and analyze all the different factors that prevent you from doing what you want to be able to do and come up with a plan with you. So just like no two people are the same, I've been doing this for more than 20 years, and I can tell you no two patients are the same, because every single person has their own personalities and physical traits, and emotionally they might be in a different place. Um, but then also how the vision affects them and what they want to be able to do and how they want to do it. For example, somebody may I've had patients who are like, I just want to be able to see my phone, to I just want to be able to read my medication bottle labels. And I had a sweet 90-year-old lady, and her goal was to be able to read her comic books before she went to bed at night. That was her routine for many, many years, and she wanted to stick with it. And then I have other people that want to do it all. They want to read books and newspaper and magazines, manage their finances, grocery shop, things that most people do. So um, my job as an occupational therapist is to get to know you so that we can work together to move you forward. I'm going to jump ahead with a couple of slides so we have time for questions later. What to expect? Like Dr. Lin said, we work as a team. You and I'm sorry, her and I work as a team, but so do we work as a team with the other doctors at Gavin Herbert Eye Institute. And it's really neat that we're able to collaborate with everybody so that we can provide the best possible care for you. If I'm not mistaken, and Dr. Lin and I briefly talked about this today, I think GHEI is one of the only places where in Southern California, University in Southern California, that offers low vision optometry and then occupational therapy services, not only in the clinic, but at home. So that's pretty neat that they were able to give us this opportunity to work with y'all. My first visit is always in the clinic. And like Dr. Lin said, the goal is to build on her evaluation. So I'm really lucky. She'll include details like what your spouse's name is or your caregiver's name is. So I really get a good sense of who's going to be walking into the room, besides getting really good detailed information about your vision from the physicians and Dr. Lin. So the first visit is going to be in the clinic, and then the follow-ups are usually in the home. Unfortunately, we are not really set up right now at Gavin Herbert Eye Institute for me to do follow-up visits at home in the clinic. Additionally, I think since your challenges are in the home, I feel really lucky that I'm getting the opportunity to work with you where you are struggling so that I can see all the different factors that prevent you from doing what it is that you want to be able to do. And so, like Dr. Lin mentioned, there are so many different things that people come with as complaints, like, not being able to see their food in their plate. Or sometimes when I ask them, like, do you drop your pills? They look at me like, oh my gosh, how did you know that? Or can you put toothpaste on your toothbrush? They just look at me like, how do you know that? They're very common struggles with people that have vision problems. Reading is one of the most biggest complaint that we hear about. Recognizing faces, watching TV, glare, navigation and driving, like Dr. Lin mentioned. Difficulty finding things is also common with certain eye diseases. And then I always, often have people that come in and say they have issues with depth perception. And then I want to understand like what they mean by issues with depth perception and exactly what activities are challenging for them because of depth perception issues. Some people have fluctuating vision. And so I just want to go over one activity, right? Reading, one of the biggest challenges for people that have vision problems. there are so many factors that need to be taken into consideration before we start showing devices. And I'm going to be honest with you, I've worked places where it's very device oriented and it's all about, let me show you this, let me show you that. And you get a device, and I'm sure some of you have had this experience where you get a device, you spend so much money, you go home and you're like, oh, it's not working. And there are multiple reasons why. But let me share some of the factors that really need to be taken into consideration before we even talk about devices. The first one is the decreased visual field, right? So on your left, there's a picture of somebody who has a reduced peripheral field loss. And on the right, that's kind of how words look like for people that have a central visual field loss, where they might be missing some letters or words, or they're blurry or fuzzy and they can't see them well. So, or sometimes it's a combination. Somebody might have macular degeneration and glaucoma. So we really want to understand this. And because Dr. Lin does the tests, and because your ophthalmologists do the peripheral visual field test, she does the central visual field test, I get a really good idea about where your vision is. Decreased resolution, that's where, looking at the big E on the wall or reading the numbers on a number chart. Decreased contrast. Sometimes people get really excited because they're able to read with reading glasses in the doctor's office, but when they go home, they're struggling. And a lot of times it's because the contrast on those materials is so poor that it makes it challenging for them to read, even though the size might be the same. So we want to assess for those things. We talked about contrast, we talked about size, we talked about glare, and Dr. Lin talked about lighting. The right kind of light can really help somebody see a little bit better. Other factors are, like we mentioned, I think quite a bit today, is what your goals are. Do you want to read short text, or do you want to read long text? Do you want to read print, or you really want to see your iPhone and your computer, or both? Because it's important for us to know those things so that we gear our treatment that way. Do you have any physical barriers like arthritis or tremors or some of the other issues that might make it difficult for you to use certain kind of devices? Um, I really look at the psychosocial aspects, and I'll talk about it in a little bit, because losing vision is really, really hard on people, and everybody handles it differently, and how that affects your ability to participate in rehabilitation. There might be cognitive or other health concerns. And we need to take all of that into consideration so that we tailor our treatment accordingly. And when it comes to interventions, a lot of times, like Dr. Lin mentioned before, she'll come up with a plan, and I might go back to her and say, oh, based on my assessment, I think we need to go this direction. And then we discuss and come up with a common plan that we talk to the patient about. So can we maximize the use of your remaining vision? It's so important to identify the right tool for you, right? Because that is, I think, the biggest challenge, is figuring out what is going to work for you and your goals, and then training you in using the devices. And just a quick note, I think we have quite a few devices. My car is packed with a lot of stuff that I take to the patient's homes. And then if I don't have something with me, I'm pretty nicely connected with the vendors who could come to the house and meet us and work with us, if that's the plan that we agree on. How do you use lighting, contrast, glare in your day-to-day tasks so that you can succeed, right? Because it's the little frustrations that you encounter on a daily basis that make things so difficult. And we want you to be as independent as you want to be in your daily tasks. So whether it's difficulty seeing the microwave, or whether it's managing your medications or putting your makeup on, we'll work with you on that. Non-optical aids are aids that are simpler, doesn't require a lot of technology. So things like using a darker pen or the right kind of book player so that you can listen to books if you choose not to use Audible or something like that. How do we mark your microwave so that it's easy for you to see? Those are non-optical aids. We talked about technology a little bit and accessibility. How can I work with you so that you're able to use your phone to call people or text or use FaceTime or access your email, whatever it is that works with you. And I'm pretty good if I know what my limitations are. So if I feel I can't help you, I'll definitely connect you with the right resources. Accessibility is another aspect. I start out with a lot of the computer accessibility things, but depending on what the needs are, if a person really wants to be able to use screen readers on their computers to access print, I can introduce it to you and then connect you with the right people for additional training. Dr. Lin and I firmly believe in really giving you all the resources and referrals. We want you to do well in life. As I mentioned before, it can be very challenging to cope with low vision. Here are some suggestions that, or some tips. I would say, if needed, seek professional help. There are lots of peer support groups that we can connect you with that are really good, knowing that there are other people that are in the same boat as you, and what helps them, chatting with them, can really make a huge difference. Educate yourself about your vision. So the more you know where your blind spots are, the more you know where your peripheral field loss is, that will start the process for understanding how to use the other vision that you have. Be compliant with your medications and stay engaged. Social isolation is very common along with depression and with people with low vision. And we want you to know that there is hope, and that there are tools, there are strategies, there are other things that will help you lead a life that is more engaging. So we really hope that you come and see us and connect with us. We are excited to work with you. Thank you.